Alrighty, so we're going to get started here. Again, thank you everyone for logging on tonight, this evening. My name is Salanitro. I'm a physical therapist here at Performance Optimal Health, also TPI certified. Today we have with us Dr. Andrew Creighton from HSS. He will be with us today to share his knowledge about golf injuries, golf-related athletes. He is also TPI certified. So we're very grateful to have him here with us today, and we're going to kick it off to him to get started.
All right. So first of all, Benny and Kevin and the team at Performance, thanks so much for having me. It's kind of exciting. I love talking about golf, and you know, this is exciting for me to be involved, and I'm hoping to talk as little as possible here because I think I can probably learn more from you know, everyone out there listening, and even from Benny here. But I'm really excited to be a part of this. Like Benny mentioned, I'm a physiatrist over at HSS, and I have an appointment at Weill Cornell as well. You can go to the next slide there. I have no disclosures. So, you know, the objectives tonight, I want to really quickly just talk about golf and sort of its connection with our general health. We're going to talk about common injuries for amateurs and professionals, and along the way sort of talk about what I see in the office with golfers that I take care of. So a little bit more about myself. I did my residency in physiatry. As I mentioned, I am a physiatrist first and foremost, and that field is a field geared towards function. And you know, in our residency training, we got experience with patients that had sports injuries and musculoskeletal injuries, but we also saw patients that had spinal cord injury, traumatic brain injury, stroke, amputation. So pretty broad field, but it's really geared towards function and getting a patient functional again. And it's also known as physical medicine rehab, and PM&R is what people have heard. But then I sort of niched myself towards spine and sports medicine and did a fellowship at HSS a couple of years ago, and fortunately, you know, was happy to be able to stay on and join the group there. And I have a history with golf. I was a former collegiate golfer up in Buffalo, New York at Canisius College. Believe it or not, they do play golf up there. Unfortunately, I can tell you of many rounds where I was playing with some snow flurries, but we were playing and we loved every minute of it. And you know, I'm the third best golfer in my family. My brother down to the left there has Corn Ferry status right now and plays professionally. And my sister Kit is doing real estate now, but she played in college as well, and I'm sure could beat me at this point. So, you know, I'm a product of my mentors, and a lot of what you'll hear today is sort of what I've learned. But I want to throw out the disclaimer that I'm by no means a physical therapist. I'm not a PGA professional. I'm not a swing coach. I'm not a golf instructor. And I think that with golfers, you know, just as much as with any patient, you know, being able to know who the team is and communicate with the team are really, you know, core values that I really subscribe to. So I'm going to try to stay in my lane tonight. And if it sounds like I'm getting out of my lane, please get me back on track. So golf and its connection to health. Golf's a popular sport. You know, it's played by 55 million people in 206 countries. And it's particularly exciting to me because it's the one thing that we can do as we get older, and we can actually get better at it as we get older. So I'm always kind of excited by that. Golfers frequently play into middle age, probably more than most sports or any sport. It's considered a moderate intensity physical activity. You know, it's associated with improvements in different known risk factors for cardiovascular disease. So, you know, we're talking about physical inactivity, blood and you know, elevated blood lipid and elevated glucose levels, body composition, aerobic fitness. It's felt that older golfers may actually gain a benefit from golf in terms of their balance, muscular function, strength. And in a disabled population, what they found was that a golf intervention improved self-efficacy, self-worth, and physical activity levels. So golf really, I love it myself, but I think that it's very much it can be very connected with our own health. So as many probably have noticed, as I've noticed, there's been some trends in golf over the years. And, you know, when I was younger and I was watching golf, I was always impressed by John Daly and how far he hit it. And he may not have been the that built like a middle linebacker, but he was incredibly athletic, and some would argue is one of the more athletic guys that ever played the game. And the look of the golfer nowadays has changed, and in many respects does look like like a middle linebacker or a football player that's very well cut, and I think also has athleticism. So that's I think been sort of a unique trend that I've seen. And then there's sort of a trend that I've seen too in terms of the classic and the modern swing. So, years ago, a lot of people, when they swung a golf club, they sort of had a more free flowing concept to their swing, where there's sort of equal hip and shoulder turn, and it's sort of evolved to more of the modern swing, which you see there, which involves much more of a larger shoulder turn with restricted hip turn, creating what's called this X factor, basically, and this difference in terms of the shoulder and hip turn. The idea is to sort of keep the lower body quiet to facilitate better ball contact. But, there's a balance here, I think, between building a competitive advantage and hitting the ball further, and possibly developing secondary musculoskeletal conditions. Because as you see with that modern swing, there is it impact quite a bit of side bending going on that right side, on that golfer in the bottom left there on the right picture. And then even through takeaway, you can see that oftentimes golfers get into a little bit of extension with the modern swing. So there's been trends there. I think time will tell in terms of what those trends really mean, but I think it's important to sort of be aware of that. So when I'm seeing golfers, I think, first of all, it's interesting. There's not great. There's epidemiologic data on golf injury, but I wouldn't say it's great. There are quite a bit of papers on golf injury and epidemiology of golf injury, but there's not a lot of, depending on where you read, you may see something a little bit different. But I think, certainly in my experience, the lumbar spine particularly is whether it's a pro or an amateur, is probably the most common thing I see are lumbar spine injuries. And, depending on where you read, you may see that amateurs have, just as many elbow injuries as lumbar spine injuries. And with the pros, a lot of times, because again, they're looking to sort of, compress the ball and really engage the ground as they're hitting it. And, so they develop a lot of hand and wrist injuries. So that sort of mirrors what I see. I think obviously I see more amateurs than I do professional golfers, but I think that's pretty consistent in terms of what I see. I think spine, hip related problems are probably the most common, but closely followed by the upper extremity things that we talked about. And, professionals, as you can imagine, get more overuse injuries as opposed to the amateurs that get more of the acute injuries. But overall, globally, with all golfers, overuse injuries are far and away more common than our acute injuries. So just thinking about the low back, that with the golf swing, there's a tremendous amount of force that's in play, specifically through axial rotation, through compression, through shearing, torsion, lateral bending forces. And really, when you're talking specifically about the compressive loads, it can reach up to 8 times body weight during the swing, which is just less than what college football linemen generate when they're hitting a blocking sled. So pretty significant amount of compressive loads. And just a few degrees of intersegmental motion can cause wear and tear change to the facet joints, which are in the back part of the spine. So it is amazing what can go wrong with the golf swing if it's not finely tuned. So as I mentioned, when I think about the lumbar spine, I don't think you can think about the lumbar spine without thinking about the hip. And I don't think you can really think about the hip without sort of considering, what's just above it. They're intimately connected. And so we're going to get into that here a little bit. So, as I mentioned, a lot of my world revolves around seeing patients and saying to myself, is this hip, is this spine, is it both? And there's similar pain referral patterns when you're talking about the lumbar spine and the hip. The movement patterns are very much linked. And there's a term, hip spine syndrome, that's actually in the literature that's been used to describe coexisting hip and lumbar spine disorders. So there's very much a connection here. And so we're just going to highlight some studies that were done that sort of speak to this. So there was a study done in 2007 by Ben Gallum's group, which looked at the effect of total hip replacement on low back pain. And what they found was that both low back pain and spinal function were improved following a total hip replacement. So, it's interesting. I think, we do see that quite a bit. Patient has some back pain, has some hip pain and pretty bad arthritis, and they end up getting their hip replaced, and both their back and their hip pain improve. So it's kind of neat. And then this study by Buckland looked at patients from 2005 to 2012, specifically who had undergone both total hip replacement and spinal fusion, to see what the effect of the lumbar fusion was on the stability of the total hip. And what they found was that those that had a history of the lumbar fusion had a higher rate of dislocation of their total hip replacement than controls. So without spinal fusion. So you're getting a sense of what strong correlation there is between movements in the lumbar spine and movement in the hip. There was a group in St. Louis, Dr. Van Dillen, who looked at is passive hip range of motion, hip rotation range of motion, different between people with and without low back pain who participated in sports requiring repeated rotation, so rotational sports, and particularly of the trunk and the hips. And what they found was that those that had low back pain had less overall passive hip rotation motion and more asymmetry of the rotation side to side. So than those without low back pain. So again, it speaks to the fact that, if you're not rotating well through your hips, you have to get the rotation from somewhere. And so, it stands to reason that you're going to get it probably from what's just above it in the lumbar spine. And the lumbar spine doesn't like to do a lot of what I tell patients, twisty, turny, bendy, lifty, twisty things. I tell patients the lumbar spine doesn't like a lot of that. And then the last study is one that was done out of HSS, actually by a colleague of mine, Dr. Vod, who I just saw about an hour ago. And basically what they looked at was, is there a correlation? This was done in 2004. They looked at, is there a correlation between range of motion deficits in the lead hip and lumbar spine with previous history of low back pain in professional golfers? There was two groups. There was a group of that had low back pain greater than 2 weeks, affecting quality of play in the last year, and then a group with no history. And what they found was that there was a significant correlation between low back pain and decreased lead hip internal rotation, Faber's distance. So that's flexion of the hip. So bringing the hip up towards your chest, bringing it out and externally rotating it, the distance between the knee and the table, and then lumbar extension. So again, this strong hip spine connection, and specifically in this professional golf population. So when I'm thinking about the low back pain in the golfer, besides the hip, I think it's also important. I mean, it's important to think about the whole body, frankly, but other areas that I look at are thoracic mobility and even mobility at the ankle, and just below the ankle joint. I think motion of the feet and ankles is something that's very underrated with the golfer, but is very, very important. So next, just really quick, far and away, the two most common things that I see in terms of elbow injuries are pain on the outside of the elbow and pain on the inside of the elbow. And, people think of outside of the elbow pain as tennis elbow and inside of the elbow pain as golfer's elbow. But I'll tell you, I see tons of golfers that get tennis elbow. So, this name epicondylitis is really more of a misnomer, because it's really not an issue of inflammation. It's really more of an issue of overuse and then change in sort of the collagen that makes up the tendon. And so it's one of those things where you have to give time to rest and then build the tendon up again. But we know that with the work of Dr. Jill Cook, that with slowly progressively loading the tendon back, you can actually get it stronger than even it once was. But taking care of your tendons, does take time. So that's definitely probably the two most common elbow injuries that we see. And then
Dr. Creighton, can I ask a quick question about that?
Of course.
Just with your experience with, working with obviously golfers, and when someone comes to you with that kind of lateral medial elbow pain, and they start feeling better after a couple of weeks of probably PT or rest or a combination of both. How do you kind of guide them back to the golf course and kind of educate them as to how long they should really wait to go back? You know, is it okay to maybe hit my wedges? And what are your thoughts kind of about some of that stuff?
Yeah, so I think a slow titration back is important. I look at what the root cause of it was in the first place, and I'm a big believer. I try, for new patients that I see that are golfers, I try to see if they can bring a video of their swing, and I really get into, again, trying to stay in my lane and not stepping on the toes of golf instructors that know way more about the swing than I do. But oftentimes you'll hear that something's changed in the swing, or they're playing more, or so I try to really tease out by talking to their team, and that's one of the sort of the take homes here, try to tease out what may have led to this, right? So in the process of building up, trying to reach out and communicate with the team to see, like, okay, what may have actually led to this, and thinking about how we can sort of maybe modify it. Of course, I would lean on the golf instructor to sort of help me with that, how we may be able to modify the swing, how we may be able to modify kind of the slow titration back and have the golf instructor watch them, that they're not sort of overdoing it. But I think, you're right in suggesting that, you may want to, go with the shorter clubs and then slowly go up, to the longer clubs, the woods and whatnot. But even looking at things like the golf grip, and even, there's so many little things that, I always think patients come to me with an issue that's directly linked to an activity. If you don't look at the activity, you're probably missing out. So I try to really hone in on those things, look at their swing, talk to their team, and really get at what the root cause is. And then, exactly as you said, slow titration back is really key.
Thanks.
So then the last sort of main area are these wrist and hand injuries, and there are more acute injuries. Of course, you can also have chronic injuries to the TFCC, which is on the ulnar side, or the pinky finger side of the wrist. So it's a cartilage complex in the wrist that can get injured more acutely. So if someone hits a tree root and the club just sort of bounces off of it, and really kind of stops and sort of jolts the hand, the wrist, that can really stress that area out. You can actually get fractures of some of those small bones in the hand and wrist, and acute ligament ruptures can happen. But then we see a lot of the more chronic stuff too. So things like trigger finger, where there's an issue of the pulley system in the finger, tendinopathies, and even subluxation of tendons. We see inflammation of the sheath that surrounds the tendon. So that's what you see with the de Quervain's disease, which is more on this side of the wrist, more on the radial side of the wrist. And then you get ruptures and of some of the tendons here on the flexor side of the wrist. And then you can get nerve compressions as well. So it's amazing that the hand and wrist looks like such a small area, but there is so much going on there, and it's pretty intricate. So it's very common in the golfers, especially professional golfers that are hitting tons of balls and really prioritizing compressing it and taking a lot of turf. So there's a prospective study done by Dr. Hawks and his group over in the UK that looked at professional golfers and their wrist injuries. What they found was that at this cross-sectional look in time is what they kind of looked at. 30% of golfers reported various wrist problems. So it's incredibly common, and it's incredibly common for a lot of these golfers to sort of be trying to play through it. The vast majority of issues occur in the lead wrist. So in a right-handed golfer, that would be in the left wrist. And the most common location, again, is on that ulnar side. And if you think about it, as you're kind of going through impact, there's quite a load that goes on oftentimes on that ulnar side of the wrist. So it makes sense. So just in conclusion, my conclusion is kind of short and sweet. I think that when I'm seeing a golfer and they've got a golf-related injury that's sort of directly linked to golf, or they're hurting when they play golf, I think you need to watch them swing. I feel like I'm getting more and more of an appreciation for that. It can really be sort of a game changer in terms of watching them swing, or seeing what they may have changed with their game, their swing, with their grip. You really have to sort of get into the nitty gritty of that. And that's where I think, is it imperative that whoever you see plays golf? No, but it's helpful to be able to speak the language. And I try to do a good job of that with golfers that I see to try to relate to them. And then I think talking to their team is just so crucial. I can't emphasize that enough. I learned so much, from the great physical therapists at Professional, but also, a number of physical therapists that we work with, just talking and I learn as much sometimes, if not more, from the physical therapist than they may get from me. And I think that, you have to have a respect for the team, because unfortunately, I don't get much time with patients. I'll get a 30-minute, 15-minute appointment, but their therapist and their golf instructor are seeing them much more frequently. So I really, really try to do a good job of communicating with all members of the team. So those are my references, and I'll kick it over to Benny here.
So yeah, any questions you guys have, either for myself or Dr. Creighton as we go here? I think Gabby is loading the slides here. And I'm going to talk a little bit really today about kind of what we do here at Performance, which we do here in our golf simulator in New Canaan as well. Kind of looking at the TPI screen and kind of how us as physical therapists and movement therapists kind of help kind of optimize your game and go from there. So Gabby, if you want to get started there. So just a quick overview again about golf-related injuries. I know Dr. Creighton just spoke about them, but they're often really a product of overuse. And again, the most common sites of injury are the wrist, elbow, hips, and the low back. As Dr. Creighton said, that ground reaction force can sometimes equal up to 6.5 to 8 times your body weight immediately after impact. Okay. So again, kind of the emphasis from both Dr. Creighton and myself, but really what makes that golf team, and for your professional golfers, really all the way to your amateur golfers, what's really going to be the best way to keep you healthy and performing well. So it's not just going to see a great PT, going to see a great physiatrist or MD. It's really a whole team approach, right? So you have your performance coaches that work on your ball striking, your short game, your putting. You have your medical professionals, your TPI certified PTs, trainers, massage therapists, nutritionists, and then also your club fitting. Because club fit itself, if the club's too long or if a club's too short, can also lead to a variety of injuries that we'll see. So what we do here and what differentiates us as physical therapists and movement therapists is really our physical screen, right? So it's important to understand in the body if you have a mobility versus a stability issue. If you look at this diagram on the right here, this is from Mike Boyle and Gray Cook, who are great innovators in the movement performance kind of industry here. You'll see that all the segments that are highlighted in this kind of red area here are what we would refer to as more mobile joints, right? So your upper thoracic spine, your hip joint, those are joints that like to move in a lot of degrees of freedom and movement. All the areas highlighted in blue are your more stable joints. So your lumbar spine, your knee, they really don't like to move too much. What we often see in golfers is, like Dr. Creighton kind of alluded to before, is you have a loss of motion in one of those red joints. So if your hip's not really moving well, your body likes to cheat and find ways to gain that mobility. So it'll go up to your lumbar spine in that blue area and gain mobility from there. What that leads to is injury, poor performance, and usually a combination of both. So it's important to kind of differentiate if there's a mobility issue that's not moving well or a stability issue that might need some strengthening. And for us, it's that ability to really diagnose if that intra-articular kind of pathology is really present there. So again, a brief overview of what TPI or Titleist Performance Institute really is. It's a set of 15 screens that are related to the golf swing and golf specific movement patterns. The other thing that it really does, it's not just physical therapists that use it, it's physical therapists, golf coaches, MDs, players themselves. It allows all of us to speak the same language and evaluate someone on the same playing field, right? So if you go to your TPI coach and you tell them that you didn't pass 1 or 2 of these tests, and you come to me, I'll know exactly what I can kind of tailor your program to work on and really what that will correlate to as far as your swing fault or any mishits might correlate to down the road. So tapping a little bit more into the golf swing itself. So here this is what we kind of call the kinematic sequence. So essentially what it means is, how are you transferring that ground reaction force up from the ground through your lower body, through your upper body, into the club head and essentially into the ball. So this is a key element of optimizing a safe, repeatable, and effective golf swing with proper neuromuscular kind of firing patterns here. So again, if you look at the graph on the right, you'll see this is a great example of someone who's very efficient, right? You'll see that they kind of start their swing, their downswing from the pelvis, through their thorax, into their lead arm, and then into the club. And you kind of want a similar sequence for decelerating as you kind of hit the ball there. Again, any sort of variance here, you're going to see injury, swing faults, and obviously mishits. So on the next one, here's kind of a little bit of a better visual, I think easier to understand. But you see here how the golfer is able to kind of create that speed from the bottom in his hips, through his core, into his arms, and into the club. And kind of, Dr. Creighton, I actually wanted to ask you here, kind of what your thoughts are as far as, you know, we were talking earlier about some of the changes that we see in the game now and how they're more athletic, but also obviously the big emphasis right now is speed and power and hitting the ball further. So obviously in order to do that, you're going to put your body through a lot more torque. So how do you kind of see that going down the road as far as longevity for golfers and kind of what that might mean for that?
It's a good question, Benny. It's something that I wonder. I think you know, it's not a real exciting answer, but time will definitely tell. I think that whether we like it or not, they're probably going to do it because they can generate a lot of you know, they're probably going to keep emphasizing power because it's important. And I think there was some sort of stat I saw the other day about, like, you know, how much money sort of the five guys that hit the furthest make, you know, so the money's pretty strong. And I think that the reality is that they're going to be looking to do whatever they can to hit it further, because, you know, you saw in the US Open how Bryson DeChambeau just, like, you know, broke, you know, made Winged Foot look, you know, not as hard as obviously everyone knows it is. So, you know, I think that time will tell. I think anytime you sort of get someone going to the extremes of what their physiologic limitations are, you do worry about some sort of breakdown, you know, whether it's in the lumbar spine, the hip, the knee. But, you know, I think that a lot of these pros are looking at their swings a little bit more in depth now. You know, you spoke to the technology, and there's a lot of emphasis on where this power is coming from, and they can sort of really get a sense of the nitty gritty of, like, where the stress points are in their swing and stuff like that. So I think that while it's definitely something that, you know, is something that I'm going to watch closely, I think time will tell. And I think, you know, it's interesting. Maybe, you know, it won't be as, you know, some may look at it and say, oh man, you know, you're putting it at extremes of motion, you're asking for trouble. Maybe, you know, but I guess we'll see. And I think that whether we like it or not, you know, most of these golf courses now are just getting longer and longer, and you have to be able to hit it far to compete.
Yeah, I think it's interesting. And I think obviously, like you said, time's really going to tell, especially with the Brysons and the Koepkas of the world that are really just kind of changing the game, but also we'll see how long they can really hold up their body of work.
Yep. They're doing pretty well.
Yeah, not bad start. So one thing that kind of TPI likes to emphasize is the fact that not every golfer is supposed to swing the same way, right? So again, kind of talking about some of the changes that we've seen in the golf game, right? Everybody's body moves differently, and the key is really just making a golf swing as efficient as you can for your body and your physical limitations. So I thought it'd be good to look at a couple of professional golfers here, and obviously some pretty good ones. So you have Dustin Johnson on the left, right? And you can kind of see where I've labeled, you know, he's got this little wrist hinge up top that he does. And you can kind of see how much more he's really rotating through that pelvis and thoracic spine. Or if you look over at Tiger, he's got kind of that more traditional golf swing that we've obviously seen so many times over the past 20 years. That's really just looks like he's totally in control. But again, two of your, you know, great golfers of the last 2 decades, and they really don't look anything the same. But if you break them down from a swing perspective, they're gonna swing the same way. They're still gonna transfer all of their weight and move through the same kind of pattern if you get them on any sort of video calibration or K-vest to really break down where they're generating this force from.
I think
And
you bring up a good point there, Benny, that the one thing I meant to say was that at the end of the day, everyone is still an N of one. And what someone may be able to get away with, another person may not be able to, just by virtue of, as we talked about, the differences in hip range of motion, stuff like that. So great points on your part.
yeah. And again, here kind of looking at some of maybe the more unorthodox swings that if, again, neither myself or Dr. Creighton are swing coaches, but if we had a patient bring us in a video and we saw someone swinging like this, we'd probably tell them that that's not the way to swing a golf club. But if you really look at it, right, these two guys are both on the PGA Tour. You have Jim Furyk and Matt Wolf over here, who's really kind of got the funkiest swing of them all. But again, you look at where they set their hands. You look, Matt Wolf's got this kind of weird foot thing that he's doing over there on the right. Things that we would have never taught in the golf game 30, 40 years ago. But still, this is how their bodies move. And this is the most efficient way for them to generate that power. And again, they're still getting through and generating the force the same way. It just looks completely different based on their body and swing characteristic.
And the other thing, Benny, is we always forget that these guys are under so much pressure. And these swings are consistent and repeatable under pressure. And that's like huge,
Yeah. So going from the professional golfers now, I thought it would be good to break down some video and kind of show you guys what we do here with the TPI evaluations in our simulator, being able to really record and break down different swing faults. So I wanted to go over kind of the three most typical swing faults that we see in our amateur golfers and really regular golfers. So the first one is what we all refer to as kind of over the top here. So if you look at the picture on the left, you have this yellow line here that I drew before I started my takeaway, but that line was going up through the shaft and kind of parallel through my body there. And then as I get to the top of my backswing here, when my lead arm is parallel to the ground, with this red line, I draw another line here kind of coming down the club shaft towards the ball. So ideally, in an ideal world, you kind of want to be in this green zone that I labeled here, right? That's called being in the slot. When you're in the slot, you're going to improve your efficiency, you're going to improve your power, and you're obviously ball striking, right? Anything you see on this red arrow, if you look at my still frame here, you can see where my club head is. I'm coming over the top of that slot line. You're going to be a little bit too steep, and you're really going to tend to block out and kind of push or slice to the right, which happens to be my miss in the golf shot. Anything on the yellow side is going to be too shallow, and you're kind of going to scoop under the ball and hit way too far below the ball. So some of the reasons that we do this as golfers are because we can't really dissociate from that lower half to our upper half. And then on the next video here, you'll see kind of one good mobility exercise that I really like to integrate. It's just an open book rotation here, but really helping to kind of focus on dissociating your thoracic spine from your lumbar spine here. So the key is you want to keep your hips stacked on top of each other and really just focusing on mobility as much as you can get there. So the next swing fault I wanted to talk about is something that really most golfers struggle with. Almost 70% of all amateur golfers have this swing fault. So it's what we refer to as early extension here. So how we evaluate this one here is before you start your backswing or hit the ball, you would draw an imaginary line kind of on your backside. And ideally, for most golfers, what we would like to see is the ability to keep your bottom on that wall there and actually even turn through it. A lot of times when you lack that lead hip internal rotation that Dr. Creighton was kind of talking about earlier, you really struggle to actually turn off of that. And what you'll do, again, is another one of my swing faults here is I kind of jump towards the ball here. So instead of being able to post up on that lead hip and rotate, I'm actually just jumping towards the ball. So again, two of the exercises, Gabby, you can go for it, that's fine. So two of the exercises that I really like to focus on with this one, the video on the left here is a 90-90 hip stretch. So you're in this 90-degree position of both the lead hip and the posterior hip. You'll see there I start with a little bit of a flexion there and then cross my arms again and try to focus on a little bit of rotation of that trail hip. The one thing I do want to put out there as a disclaimer, this one can be a little bit of a compromising kind of position here. And really with all the exercises that we suggest, if any of these do cause you discomfort or any pinching, make sure you follow up with a medical professional. Make sure that there's no intra-articular pathology that's really causing that. The video on the right is more of a strengthening exercise here, really looking at a single leg glute bridge. So being able to get that trail hip kind of through and being able to post up on that one side. Not only does it require mobility, but you need the stability and the strength of both your core and your gluteal muscles there. Good. So the last two swing faults I really want to review here are what we call sway and slide. So sway and slide are two lateral swing faults that we'll see with golfers. So a sway being the first one here, and you can see Mike here who works in our Greenwich office. So what we'll do is we'll draw a line up the trail leg side here. And if you lack that trail hip mobility, so not the lead hip, but your trail hip, if you can't rotate on that trail hip, what you'll see is you actually tend to shift your body weight over to the side instead of actually rotating on that leg, right? So what this is going to lead to, other than injuries in your lower lumbar spine, but also from a performance standpoint, you're not going to be able to generate that same power. You're going to lose efficiency, and it's going to take a lot more effort to try to hit the ball further there. And now a slide is a lateral movement to the opposite direction. Here you see Kevin here in a very nice slow-mo video. But what we'll do is we'll draw a line up the lateral ankle here. And as a golfer swings, you want to see them be able to post up on that lead hip, right? And obviously Kevin here is crossing over that line. So any lead hip internal rotation deficit, any lead hip balance deficits, you'll see that inability to really kind of stay on that leg and hit through the ball. So again, with either of these lateral movements, you want to try to be quiet in your legs. Like, again, Dr. Creighton, you were speaking of before, anytime you have a loss of strength, balance, mobility, whatever it may be, and that's what our screen really tailors us to, that's what you really want to focus on there. Dr. Creighton, do you tend to see a difference in hip mobility deficits from one side to the other?
I would say that, yes, I definitely do. I mean, it sort of depends. We see them on both sides. I think that, probably a little bit more, if you think about it, sort of the loading and posting into that lead hip, maybe a little bit more deficits on that side. But I think, we do see it a fair bit. And I will tell you that a lot of times if I have a patient with back pain, particularly, I will definitely go and look at their hips actually first to see, and frequently we'll find that there's range of motion deficits. And so, I think that it probably goes both ways, but I think probably maybe a little bit more so on the lead side.
Yeah. And kind of piggybacking off that lead side there, we do have a question from the audience asking, where should the lead leg or hips end up to correct the slide? So a slide is actually a little bit of a tricky one because a lot of professional golfers actually have that kind of fault. You want that lead leg to kind of stop there. And you see how Kevin kind of keeps going over that line. You really want to be able to just stay on that lead leg and rotate over that leg instead of bringing your body weight forward. Again, that's a tricky one, and one that honestly, we're able to identify, but one that a swing coach is really going to be able to correct and kind of tailor more things towards. But I hope that helps answer the question. And Gab, if you don't mind going back there, these were just two of the exercises to correct those sways and slides, right? So a single leg Pallow press, working on that single leg stability there, and a little bit of oblique strength from that wall and the cord on the outside there. And then a half kneel chop. Again, I like half kneeling and single leg positions for a lot of my golf training and things that I do, because a lot of what you do is really unilateral and focusing on that stability as you're rotating. So just a little tidbit of some of the stuff that we do here. And then Dr. Creighton, just another question I had, kind of thinking about, other sports that we see, and a lot of kids now are going to start picking up golf, I think, because it's becoming so popular and you see it on TV. Do you have any worries really about like specialization in sports, so to speak? We see it a lot with baseball players, right? And we see all these kids hurting their elbows because they're pitching too much or playing too many innings and whatnot. How do you see that with golf really kind of shaping up as we go towards the future?
Yeah, I mean, I think you just said it. Golf is very much a unidirectional sport. And I think the problem is that if you only play golf, you can definitely become dominant one way. And I think unless you're hitting balls on the range, both left and right-handed, that I'm definitely a big proponent of mixing it up, playing a lot of different sports and playing sports that require movement both ways, and that's really sort of the way I think you develop a body in terms of making sure that it's sort of symmetrical, muscle balanced, those types of things. So I think, our bodies are not designed for unidirectional things. And I think that, I think that that's the risk if you just specialize in golf, to be aware of, that you really want to make sure you're training the opposite, as much as possible.
Yeah, awesome. Let's see. I think there is one more question from Michael asking if we can send a soft copy of some slides here. We will be posting the recording of this to our website. I'm sure we can find a way to get some of those slides over to you as well. That shouldn't be a problem either. Let's see. Any other questions here? What type of golfer could benefit from eval or screening? Thanks, Gabby. So that's a great question. I think all golfers really can benefit from any sort of screening or movement screen, right? Whether, obviously with TPI, we're really able to tailor it specifically to the golfer. We see everyone from 2 handicaps to 20 handicaps. I myself kind of sit in the middle of those, and it's great to, have the resources here and to take myself through screens every now and then and check in and see how I'm doing with my own program, right? So I think it's really applicable to all golfers of all skill levels, right? Both from a golf performance standpoint, but also from just an overall mobility and health and functioning standpoint, right? Because at the end of it, you should be able to do a lot of the movements that we take you through in the screening itself. So I think that's a great question. I think it really depends on what you're looking for in your golf game, right? And I think having a full team that we spoke about before that's able to all speak the same language and all work together to develop that program for you is really what we're looking for there.
I totally agree. I think that's well said. Yep.
Brian asked if there are certain movement faults that are more common. Yes, Brian, you slightly missed that now. Okay. Some of the more common ones, again, are that early extension, the over the top, and the sway and the slide that we kind of covered today. So those are kind of the 3 biggest ones. Really, the way TPI breaks down, there's really 12 common mistakes that we see. So it can be anywhere from just scooping or casting your club as you go down. And those are a little bit more specific. I didn't really want to take too much time today to get into those. However, going back to Gabby's question, when we do a full screening, it's usually a 2-hour process split into 2 days where we take some video analysis and break down which swing faults each golfer kind of falls into from there. One thing I don't think that was talked about was knee pain. Will this generate primarily from lack of hip mobility or strength? That is a great question, right? So Dr. Creighton, you want to tackle this one? I don't mind tackling it.
Yeah, no, that's fine. I mean, I think that, the knee, we want it to be, as Benny talked about, sort of the knee, while we want mobility from the knee, it's one of the more stable things. And so I think that particularly in that lead knee, in the right-handed golfer, the left side, when someone has an issue there, oftentimes, we do look to the hip to say, is there a restriction in range of motion that's leading to that? Is there a strength deficit around the hip as well? Actually, even though the hip we want to be more mobile, we certainly want a lot of core and hip girdle strength as well, because we know that translates down the chain to more stability at the hips, or more stability at the knee. So I think that, you're really onto something with the question. And I think that whenever I see a golfer with knee pain, I certainly will look to the hip, and frequently we do find that there's an asymmetry there, whether it's decreased range of motion, decreased strength around the hip, particularly of the gluteal muscles and particularly of the posterior gluteal muscles. I think are some of the major things that can contribute to knee pain in the golf swing. And there's a famous saying out there that's he who treats the site of pain is lost. And I think that's very much true with a lot of stuff that we do and see, and that's probably true with the knee.
Yeah, I think to your point too, especially kind of talking like we were talking before, every golfer is an N of 1, so everyone moves differently. And I think, finding that source of pain, it comes from a lot of things. It comes from your movement screen. Do they have maybe an ankle dorsiflexion mobility deficit, right? And that's causing them to squat differently. Do they just have a weird, funky movement with their swing where they're just trying to hit the ball 400 yards and totally winding up. I think it's really varying to each golfer and each screening and kind of going from there.
Yeah.
But again, I think you hit the nail on the head. It tends to come from the hip, but it can come from a lot more than that, obviously. Let's see. What type of technology is available to get analytics and performance metrics? Do you recommend using it / could it be detrimental to use too many analytics and tech? I think so there's a lot of different tech out there, right? You have K-Vest, you have ground reaction plates, you have TrackMan, which we have right behind me here, right? I think that, again, I think it depends on your skill level, right? I think if you're a lower handicap player and you know how to shape your shot and you're looking to do certain things in your game, having the power of those analytics behind you are really, really helpful. I think if you're even a novice player and you're just looking to try to get some more general information, having that info can be helpful. I think it really depends on you as a person and as an athlete, right? Obviously, having too much information in any facet of life can be an abundance of information and knowledge and kind of overwhelm you and get you doing different things with your swing that you might not want to do. I'll say that our TrackMan's been great. I mean, it's, the things that I really look for are club head speed, swing path, and club to face path, really. So just making sure that those three things are either improving or doing what we want them to do based on some of the shots you want to hit. I think if you start to get really, really too technical, you can probably get a little bit in your own head. But again, I think that's kind of specific to each golfer and each kind of athlete from there. I don't know your thoughts on that. You're obviously a skilled golfer there. When you were playing in college, what kind of technology did they have back then?
We didn't use a lot of technology back then, to be honest. I mean, this was like 10 years ago now, but it's crazy, 11 years ago. But I think that I think you definitely, if you're competing, I would be careful with, especially when you're at the end of the day, you got to go out and play golf and score. That's what it's all about. And so I think you got to, regardless of the amount of analytics you want to put in play, which I think are very, very helpful, 100%. And everyone's, gaining something from it. And it's nice to have metrics to sort of track to see how you're doing. But at the end of the day, the objective is to shoot a lower score than your buddy. And I think that, the as simple as you can keep it on the course, oftentimes I've felt for myself is more optimal.
Yep. I totally agree there. The last thing you want to do is try to correct 8 swing faults while you're teeing up for the first tee, right? And we hopefully know golfers listen to this, start doing that after this. That's problematic for everyone.
Yeah.
Let's see. I think last question here. What would be your recommended warm-up routine before a round? So honestly, going through a lot of the mobility things that I kind of posted, some of those exercises, I love doing open books. I love hip opening stretches. And obviously, trying to hit the range beforehand. I say that, and any of my friends, if they're listening, know that I'm literally the last person to hit the range beforehand. But going to the range, hitting your wedges, going up, kind of progressing from your lower clubs, obviously through your driver. And again, I think it depends on each golfer. Again, if you have a history of certain injuries, right? If you have certain shoulder, elbow, upper body injury, you do want to stretch that area out. I think, working with your team and your professional or your physical therapist, trainer, whoever it may be, establishing a good warm-up plan is really specific to each person from there.
Yeah, I think the warm-up is really, 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 really important, especially for people that only play on the weekend. I think that warm-up, you got to remember that, I think, not to get too into the weeds, the warm-up, you want to be more about mobilization and really sort of about activating your system as opposed to just stretching muscles, because stretching muscles doesn't really prime them for being active and so I think you see a lot of people just purely doing stretching, but you want more of a dynamic, active, mobilized warm-up where you're really, doing some hip hinging, doing even some just maybe basic squats with, a club over your head and, really, really, as Benny said, sort of getting the system warmed up before just running from your car to the first tee. I think that's a recipe for disaster.
Yeah,
I'm guilty of it, though.
Yeah. It happens time to time, right?
Yeah.
And actually, last question was from Brian here. How often do you recommend that someone continue with a golf fitness / self-management program given to them from a TPI screen? So again, your screen is going to speak to how often you really should be going, right? Some golfers can come in and they really just want to fine tune a thing or two, and they move well, they're strong, they're mobile. They could be once or twice a week, whereas some golfers kind of starting from the ground up, we really want to get them in there 3 times a week for a good 6 to 8 week program. So again, it's really tailored specifically to each golfer. We try to individualize it based on what we find from them and what their specific needs are. Obviously, you know, as spring starts kicking around, hopefully golf plans are in kind of travel, right? Everyone's going to be doing a lot of home programming on their own. So again, just making everything tailored to each person there. Any other questions from anyone else out there? Again, I want to thank Dr. Creighton for joining us today.
Thanks for
that was a
having
lot
me.
of fun. It was great to have your expertise with us here, and obviously talking golf is always fun for all of us. And for all the listeners and viewers today, thank you again for taking your time. And if you have any questions, again, you can find us at performanceoptimalhealth.com. Yeah, thanks.
Take care, everyone.
Everyone.